Okay, patients should always go to an inpatient facility in their final days. True or false? False. Okay, thanks.
That was good.
Huh? Oh, keep you straight. Okay. So, I gave you the yellow sheet of paper as a handout. So I just want you all to be aware that, you can find hope in hospice. For many people, we know that hospice is, conjures up scary thoughts, okay? But people don't realize how much help hospice can give you in the home. And that people, when they come to hospice, they do, like I told you, with all, Anne-Marie said, with the nurse coming out often, consulting with doctors, having our aide come out, you feel, you get all that foo-foo, as I call it, you start feeling better. We are all about quality of life and comfort, okay? So, by definition, hospice needs holistic care, okay? For those that have life expectancy of 6 months or fewer, but no one has a crystal ball, okay? It's only up here, and you're well. Okay, everybody? Okay, and I guarantee you no one has lived to 150. So really, my mom says, sign me up for hospice as soon as I qualify. Because she knows all about the benefits. Okay? We'll get into that later. Okay, hospice provides a medical team taking care of the patient and their families. Okay? And we'll get into more later. I just wanted to give you a little overview. Question? What?
Go back a step there, and I'm intimately involved. Who is it that has to say how long somebody has to live? A doctor? You have to get a certificate, or how's that work?
The doctor has to sign a certificate of terminal illness, saying that in his or her best opinion, this patient probably has a life expectancy of 6 months.
If at that moment, everything were to go the normal course.
If the decline continues on its normal course, exactly, perfect word. That's what they would write.
Okay, that's the doctor. It's like,
The doctor would write, if this patient continues to decline, if the disease continues to take its normal course, this patient probably has 6 months or less. In my best opinion, it actually
Okay,
says.
what you get into is you have a family physician, and he says, you've got cancer, you go over to the cancer clinic, and they get chemo, and they say, can't do anything. They send you to the radiation, and the radiation says, well, it isn't working, and that's it. But nobody will say, who do you get the certificate from?
So that's when that physician that says this chemo is no longer working and it's not doing you any good, he should be talking to you about hospice. And a lot of times what happens is that physician will actually call our office and say, hey, can you go to Mr. Smith's house and discuss what your company can do for him, because I believe he may be needing your services. We'll send a nurse out, she'll do a nice write-up, she'll do an assessment, she'll talk to you about your needs, and then I'll bring it to our hospice physician. Our hospice physician will look at it, she'll sign off on it, and then I send it to that primary physician of yours, and he agrees with that physician's plan of care together.
But it's the physicians.
The oncology physicians and others are tough. They're tough sells. They always want to try something else. It's
Yes,
true.
they are.
Yes. I'm an oncology nurse as well, so I know.
Thank you.
Yes. Another
You can do
question?
a self-referral too,
Is there another question? No.
okay?
You can do a self-referral, but I still need a physician.
Right. Okay, and we'll be discussing all of these aspects as we go on. Okay, so I want to give you some things to think about. A person can be a candidate for hospice if he or she has lost the ability to care for himself or herself independently, has reoccurring infections resulting in numerous visits to the doctor or the hospital. Did I have that class?
You did, yes.
Everybody's on their game, except me, obviously. Lost 10% of his or her body weight unintentionally.
Within 6 months.
Within 6 months. Okay, so I want to bring up, Dr. Oz says you know, he gives good advice. Everybody loves to watch Dr. Oz. I do at least. And you know what you need to consider is everybody that's involved in your health care, your health, should be vigilant and passionate about getting you the best health. You know, when you go to the doctor, you have home health care, you have hospice people, you know, you have to be vigilant too, okay? Because everybody these days is after their almighty dollar, okay? And you gotta make sure that everybody has your best interest. And I really believe that you need to know it before you need it, okay? Know your options, know who you would call and why, okay? Make sense? Okay, give you a little background in hospice. Okay, where did the concept of hospice come from? Well, you know, back to give you a little school lesson. It comes from the old French, I can never pronounce things. Hospitium means hospitality, and also Latin, okay? And it was a shelter or lodging for weary travelers, and to take care of the sick, okay? The hospice program provides palliative care and attends to emotional and spiritual needs now of the terminal ill patients at inpatient facility or at their house. Okay, and you might hear of this lady. She was very instrumental in bringing the hospice movement to the United States. It's only been in the United States since 1974. Okay, moving along. So when should someone consider hospice? That's the question. Well, when the following happens, when there's been a progressive weight loss over 6 months, Anne Marie said, at least 10% of your body weight, suffering from profound weakness and fatigue, when you've had a decline in health in spite of medical therapies, frequent infections, UTIs, pneumonia, frequent hospitalizations, needing continuous oxygen therapy, or suffering from difficulty for breathing. Just some things that might make you go,
And let me explain this last one here. Needing continuous oxygen or suffering from difficulty breathing that does not respond to treatment. Because you can have difficulty breathing, as you know, and you take a treatment and you're fine. So that's, you really have to not be responding to your medication.
okay. You gotta write that down for me. Okay, so what I'd like to let you know about it, this is also on this yellow piece of paper, okay, this is important. You know, you're kind of getting the inside track here. You can ask us any questions, okay, we're kind of giving you, like about Medicare, our rules and regulations, you know, ask us anything. But my question in how you choose a doctor, how you choose a hospital, is how do I know what questions to ask when the case manager wants me to maybe interview 2 hospice companies? What do I ask? You know, it's just how the person makes me feel. What do I need to know? This yellow piece of paper, these are the questions. How quickly can they start service? Okay, everybody might want to sign up, but will they come out, the nurse come out next week or in a couple weeks? Okay? When will the nurse, how quickly will you get me on service and will you start service? That's a big. Are all the nurses RNs? Or do they have an RN case manager who supervises LPNs? This is another biggie, okay? And how often do the nurses come out? Do they have aides that come out, and how often and for how long? Okay? Do they have, are you asking a question? Okay. You know, our service, our aides come out, if you live in the home, up to 7 days a week for an hour a day. And I say they do the food, okay? They will do light cleaning around in your room, in the room that the patient's at, brings the supplies, okay, the incontinence supplies, and the aide, they're the nurse, they're the eyes for the nurse, okay? They are very, very experienced at taking care of people in a state of decline. And I think it's because of our aides that, I mean, I have had so many people say, the patient looks so well. You know, when you have someone come out with food fluid on you and then the nurse comes out, you're gonna feel much better, okay? So, that's an important question. Do they have RN that will come out in the middle of the night or on weekends, whenever it's needed? Okay? I've heard where other hospices, they might say, well, you know, I need you to come out. Well, I'm sorry, I've already been out there that day. Right. Not acceptable in my book. Not when, because you know, we're sick, not just Monday through Friday, 8 to 4:30. We're sick 24/7. Okay? What medications, incontinence supplies, and other items, DME, durable medical equipment, does the company cover? You know, does the patient have to be a DNR in order to come to service? Some people, you have to be a DNR to come to their hospice service, not with us. And then this is a real important question: do they treat wounds and UTIs? You know, I had a patient that even though they couldn't talk because they had Alzheimer's, you know, if that was my mom, I wouldn't want, if she developed a wound or she had a UTI, just because she can't communicate, it doesn't mean that she shouldn't be treated, okay? We're all about comfort, not only for the patient, but for the family. And I wouldn't be comfortable if I knew that my mom had a serious wound and you're just giving her more morphine, okay? We're not gonna blow up, all right? Okay. I was just trying to make a joke out of it. You don't smoke around oxygen, do you? No, please. I have yet to have one of my patients show up on the evening news. Okay. I tell everybody.
But I tried that before, though.
Okay. Not a small thing. So, will the... Okay. So, we're almost done with the 10 top questions to ask. So when a patient's current medications, will the patient's current medications be discontinued immediately? So whatever you're on. We like to get to know the patient and have it as a gradual thing. You know, because anything that we do discontinue, we want it to be, have a positive effect on it. Something that? Oh, I must be doing good. Okay. So what's the company's philosophy on medication?